In this video, we're going to talk about something that walks into our clinic doors every single day, and it's something that a lot of you watching this video may actually have yourself, and that's arthritis. So to talk about this, let's first just talk about what is it.
So there's a couple different kinds of arthritis. There's something called an inflammatory arthritis, like a rheumatoid or psoriatic, where your body's own immune system is attacking your joints. That's not really our wheelhouse, but what we primarily focus on and what we see every single day is osteoarthritis, which is like a wear and tear. So it's gravity pulling you to the ground. It's the mechanical forces over time on your joints that starts to wear out the smooth, slippery cartilage surfaces and will degrade the joints over time.
Yeah, and that's like I mentioned, that's something that we're seeing every single day. And the thing about arthritic change is that it's completely normal in basically the entire population. You can think of it as just wear and tear or wrinkles on the inside. No matter what, as we age, we will develop some form of arthritic changes, and we'll see it more in joints such as some of the joints of the lower neck. We'll see it in the lower lumbar spine. The weight-bearing joints like the knee and the hip are very prevalent areas to have arthritic changes. So very often we'll have people coming into the office, they'll say, I'm diagnosed with arthritis, here's my images. It's bone on bone. We hear that a lot.
I always say you and me both.
Yeah. So and we always say it's normal. It's like wrinkles on the inside. And the cool thing about arthritic changes when we see these things on imaging is that it does not automatically correlate to having pain. Because very often we'll see pain-free individuals who are performing all the functions they want to be doing throughout the day with zero pain, but they are ridden with arthritic changes. So that's a good scenario there where just because you have it, the structure does not always correlate with function. So you could have bone-on-bone knees but still be performing what you want to do. You could be going for long walks, you could be playing the sport of your choice and have very minimal symptoms with it. But there are cases where we may need to give some more attention to this arthritis. So let's talk about the treatment a little bit.
Yeah, so there's a lot of treatments, and like you were saying, if a knee is all the cartilage is gone and there's bony overgrowth and things like that, that's maybe not our where we're the best suited to intervene in that point. But for the vast majority of things that come in here, I always use the phrase someone walks in, it's not like somebody came up and took a bat and hit you in the knee and now you have knee pain. It's something that you've done to yourself over time. And so a lot of those cases, we can figure out why are you overloading the inside of your knee and increasing the speed, the rapidity of which that knee degrades. And so we can change kind of how you move or stabilize to offload that, and we can get people out of pain despite there being some cartilage wear, because that's, right, again, normal.
Right, and very often we'll have these people coming in with, they'll say, I've had arthritis for years and now my knee hurts. There's no such thing as acute onset arthritis. Kind of like Dr. Kraft mentioned, you don't just kind of take a weird step and then all of a sudden you're bone on bone in your knee. It's something that was probably there and then you experience pain. Maybe it did have something to do with the arthritic changes, but arthritis doesn't just automatically pop up out of nowhere. This is a long-standing issue. So even in the case of these bone on bone cases, we still need to go through conservative care and do things like training strength in the affected area, training stability in the affected area. Sometimes, especially with these weight-bearing joints, weight may be a portion of that. So maybe we get you connected with a really good personal trainer or a nutritionist to help you with that. These arthritic cases are very multi-dimensional. Not all of them act the same way. So the only way we really know how we need to address it and treat it is through conservative care. If we get to the point where things aren't moving how we want them to move, then you may be a really good candidate for something like a knee replacement, hip replacement, whatever it is. If you have any questions about arthritis, how we may assess it and treat it here, be sure to comment on the video, reach out to us on Instagram, reach out to us at the office. We'd be more than happy to talk to you about how we can help you with arthritic.